All right. Welcome, everybody. We are so excited today to have another spectacular guest. Now, when we started this show, my purpose really was to find people who have a fascinating story, who inspire people, who are doing stuff that's truly making an impact. So I'm delighted today to have another fantastic physician, individual. I have the book that she's written. Actually, she's written two books, but the second book, Body on Fire, we're going to talk about that. So I'm really happy to introduce Dr. Jyothi Rao. Welcome, Dr. Rao, to the show.
Thank you very much for having me.
So let me ask you, I'm really curious. I read a little bit about you. Of course, nowadays you can ask Dr. Google to tell you something on everybody. But tell me a little bit about your journey, your story, and how you got into doing what you're doing now.
Sure. So I've been in medicine now for 24 years. And so when I left a very tertiary care medical center, which means it was a very specialized center in Boston that kind of each floor that we had, each month of our rotation in internal medicine, we had a different name. We had either gastroenterology floor or nephrology floor or, all of these subspecialties. So in your brain, you thought, okay, all these organs are separated and everybody's, unique in the sense that this organ doesn't touch that organ. And so when you come out as an internal medicine doctor and you're trying to treat people, you realize very quickly that everything's related. It's not subspecialized. It's not like the heart sits by itself and the brain's out there on its own and the kidneys are by themselves. So I was very confused when we first got out. I was like, I don't know why everybody's so tired and why I started practicing in New York and people were just unhappy and sad and couldn't lose weight. And everybody was so, it was so down and depressing. I was like, what is going on? Why are people so down like this? So I was looking for things to try to tie that together. And all I had as an internist was really medicines and surgery as an option, or maybe a referral to physical therapy or something like that. And it got kind of frustrating actually. So I became an acupuncturist, and because my patients used to kind of whisper to me, I would say, how did you get better? How did you heal your headache? And they would say things like, oh, I saw an acupuncturist, and I, they're whispering it, and their journey was so amazing that I started to learn it myself. And it kind of opened my door to this concept of healing as opposed to band-aiding. And, all those years I was practicing just traditional internal medicine, I felt kind of like I was putting out fires all the time. And it was really not a journey to heal someone or introduce them to new concepts. And that led me to the concept of like functional medicine, which is kind of healing through the gut, looking at systems as a unit, looking at the root of the problem, as opposed to the band-aids or, what everybody has heartburn, but what is their heartburn from? Is it because they're sensitive to certain foods? Is it because they're chewing too fast? What's going on? Is there too much stress? As opposed to here's a purple pill, take it and I'll see you back in 3 months. It was so much more satisfying to learn ways to try to deal with the root cause. So then I started delving in more nutrition and food and the role of, the role of what stool means. What is your stool when it looks like it's too hard or too soft? What does that even mean? Hormone balance and different things that were kind of the crux of the problem. And in my journey, I just was so enlightened because people were just getting better with little interventions like removing certain, bad foods, stopping, diet was never discussed in residency really. And when when people were just getting better by removing preserved, highly preserved foods or processed foods and even going more plant-based, and people were starting to get better with their sleep and their skin started to look better. I mean, it was a journey that I learned on the way because I didn't actually understand what was happening, but people were just getting transformed by these small interventions and no side effects, right? Because there was nothing to talk about in terms of, if you might have constipation from this. And really the side effects from this whole journey is you might feel better, you might be a happier person, you might start to smile more. All these lifestyle interventions gave you great outcomes in multiple organs without, using a ton of prescription pills, which give you multiple side effects as they kind of go on. So it was very exciting to kind of go on this journey. And then I met my co-author, Monica Agarwal, who had a very personal journey through rheumatoid arthritis when she was diagnosed. She and I wrote this book about partly her journey through RA, the autoimmune disease, which can be quite debilitating for some people, but she came out on the other end through mostly lifestyle and going plant-based and doing things like meditation and yoga. And within a few years, she was much better. So her journey is also very compelling and very nice to read about. But my journey is more about trying to find tools for my patients to try to help people and individualize treatment and personalize it. But along the way, I found it helping me as well, in my journey for maintaining my energy and trying to keep my weight down and those kind of things.
I think, you touched on a couple of points that are really critical. And one of these was this concept of healing, right? So we are in such a rush to be able to try to treat patients, and we have all sorts of modalities to treat, but we forget there are so many things that kind of intermingle together. So when you were talking, I was thinking about this self-principle concept that I have, which combines sleep, exercise, love, and food, where any one of those items by itself is important, but it's not the only thing. So I love that philosophy that you have about that. So tell me, when you talk about things like food and you talk about processed foods, one of the things that I give a lot of talks on is this concept of food addiction. And even though it's not a DSM-4, DSM-5 diagnosis, food addiction is real. And we are so addicted to salt, sugar, and fat that it's so hard for us to transition away. So how do you help your patients when you see them who are used to, the French fries, the burgers, all of the stuff, the sodas? How do you help them to make those transitions into healthier options?
Yeah, so the first thing we talk about a lot of times is their stress and sleep, because that the hormones that change when we are sleep deprived, for example, they raise our cortisol, they change our leptin, they change these hormones that are associated with our appetite. So most of the time people are not sleeping that I'm meeting, and they're exhausted, or which causes them to pick certain foods. So my first goal for people is to try to get them sleeping more restoratively. I do tell them about diet. I do talk to them about principles, but part of it is how do they actually initiate the action if they're so exhausted that they can't even think about, going to the grocery store and buying. It's a lot easier to go pull up at a fast food place than to go and make your own dinner. So I'm trying to get them more energy. And so with that, I spend a lot of time talking about sleep and talking about restorative sleep as well as stress reduction. So as part of my initial intake for people, we spend quite a bit of time talking about the role of breathing and meditation to lower cortisol, to try to curb some of those stimuli that come to us to get us to be hungry, right? So when we're overly tired, we might be eating because we're bored. And now with this COVID situation, a lot of people are home and their pantries like calling their name. We're sitting all day. So the sedentary behavior, a lot of things, our behavior dictates what we crave. Another big aspect of what I do is, when we're physically exhausted and burnt out, sometimes it's sugar we crave and sometimes it's salt. So the salt craving comes, I think, from burnout and adrenal fatigue and just like the exhaustion that we feel, because it's just draining us in terms of the mineralocorticoids and things that can happen from normal adrenal function, just from the constant barrage of like stress that our hormone is giving us. So we do spend quite a bit of time on that. So that's kind of my first point. We talk about the overall concepts, but we also need to talk about what is the day-to-day things I can do to change and improve my sleep quality and try to reduce my stress levels so that I'm not craving some of these foods. And sometimes, quite frankly, it's a habit, right? So we have to talk about why are you reaching for that food? So there's a little bit of time spent on the behavior involving food and eating. But I know how I behave when I'm not sleeping properly. I crave more sugar. I absolutely eat worse. And so I have to be able to spend time talking about that before we can go into a food plan.
Let me take you back a little bit. You mentioned restorative sleep. Tell me a little bit what you mean by that, and what are some actionable items that people listening right now and watching this right now can do to help themselves?
Sure. With sleep, people think, okay, I was in bed for 8 hours and I'm awake. I was in bed, but I wake up and I'm exhausted, as if I didn't sleep, or if it's in the middle, I feel like it's in the middle of the night. It takes me an hour and a half to wake up. I can't really do, my brain's not functioning. That is not restorative sleep. Restorative sleep doesn't necessarily mean that you're jumping out of bed ready to do a marathon, but it's a wakefulness that even if you just stretched out a little bit or just moved around a little bit, at least your brain would wake up and you feel like it's morning, you can get on with your day. It's not a sluggish feeling. It's about 7 to 9 hours for the average adult. And that's the time spent in bed, but we want it to be going through the 4 stages of sleep and REM, and doing that multiple times during the night. So you have to be able to not be up because you're in pain, not be up because you have to go to the bathroom, not be up because your spouse is snoring, So those are the things that I think initially is what is keeping you from that 7 to 9 hours of being in your bed and waking up. And sometimes it's as simple as notifications on their phone. Turn off your notifications. Sometimes it's keep the pets out of the room, figure out if there is a partner snoring, figure out how to help that person, because it is that critical to the person sleeping next to them that everybody sleeps through the night. So we talk about, in the book, we speak about, little things you can do. Turn off your notifications. Don't stare at your screen, because the light that comes from the phone and from your tablet sends a message to your brain that shuts off the melatonin, which is our sleep hormone. So we want to be able to produce that as a natural signal. So no LED lights in the bedroom, so trying to keep noises down, maybe wear something to block out the light, because any light that's coming through certain cracks, some people are so sensitive, they need to wear something over their eyes in order to sleep through the night. So it's just kind of, don't look at your emails. Don't look at things that are kind of upsetting. Maybe don't watch the news at night, So you want to go to bed, and I feel like a morning ritual is very helpful, and a sleep ritual is very helpful. So whether that means I'm going to have a warm glass of something like a tea, like maybe a herb relaxing tea before I sleep, an Epsom salt soak with a bucket that's calming and relaxing. Maybe it's a bath, but I will read a book and not read my tablet. And I will shut the light off and do something more habitual. So have a bedtime and stick to it. Don't use your bed for things that are outside of, the normal things that we think of, but do not stay in your bed and stare at the ceiling for 20 minutes to 2 hours because you can't sleep. Get up out of the bed, move around, but use it to, don't create that sleep anxiety. So part of the things we like to do is to just create a sleep ritual for people that involves electronics disappear, don't check your emails, don't do anything that's stressful, maybe read a book. But I love the concept of Yoga Nidra, which is a yoga that's meant for sleep, which is kind of a calming, either using sounds or some sort of breathing technique that'll help calm your brain down at night. But if you get into some sort of a habit, your body, again, it's kind of like you just get into this cycle where if you're not sleeping, you'll get into a cycle of not sleeping. But if you start to sleep, I think you can reset yourself.
I think what you talk about in regards to sleep rituals is so fascinating and it's so important. Most of us were so wired throughout the whole day. Everything is racing. And nowadays with social media, especially for the younger folks, it's all about that dopamine hit. It's like every 2 seconds, there's a dopamine hit. Trying to have a ritual and letting the body sort of ease its way into sleeping is so effective, yet it's so commonly mistaken. And everybody, at least in my practice, in kidney disease, with dialysis, we know that one of the biggest problems our patients have is they can't sleep. Mm-hmm. So dialysis is one of those strange things where it's a chronic inflammatory state and they really can't sleep. But when you ask them, what is your sleep ritual, right? What are you doing to improve your health? How are you trying to wind down? And literally every single one of them will tell you, they just keep watching TV until they fall asleep. They'll fall asleep in the chair. Their eating patterns are completely off. They're eating too close to dinner. So it's a fascinating point. Now, you told us a little bit about your going to bed ritual. So I love that. What's your morning ritual like? What do you do?
This is very, very important to me because I'm someone who over the years have struggled. I know all the good things that we're supposed to be doing, but I wake up every morning and try to convince myself not to exercise. I try to find a reason not to do it. Uh-huh. I struggle, but so part of the morning ritual is to create something so habitual that there is no conversation in your head for it. So you get up out of bed. So even as I enter my bathroom, I'm doing my sun salutations so that I can wake up. I don't even think about anything else. I just go in there and I do my sun salutations. Half the time I'm half asleep, but by the time I'm done with 3 sets of my sun salutation, I'm awake. And so it feels like I've just got a hit of coffee, which then gives me energy to go and exercise maybe for 20 minutes or go walk my dog for the next thing or whatever it is. It just gives me the energy for the next thing. But I try to get in some sort of stretching, like a yoga routine. I try to get in 20 minutes of an exercise and a meditation in the morning on a regular basis. And it doesn't have to be a 30-minute thing. It could be sometimes 5 minutes of a meditation. It could be 20 minutes of a workout, or maybe 10 minutes of stretching, but something that gets my body moving. And I try to do that 5 days a week because it sets my day to be a better day. And so if you have this morning ritual that's non-negotiable, it's better than if I say, well, maybe tomorrow I will do X, Y, or Z. So if you go to bed thinking, okay, tomorrow's my yoga day, tomorrow's my elliptical day, tomorrow's I'm going to get on the bike, you try not to think about it, because I will tell you every day there's a conversation in my head. Do I really want to get on my Peloton today? No, I don't want to get on my Peloton. But you just do, because that's something. If it just becomes like a get up, you brush your teeth, you get up, you do some of these things. And you try to keep it into a time frame that's limited. It's not 2 hours of my day. Maybe it's 40 minutes. All of that is 40 minutes, stretching, working out, meditating. I mean, it's reasonable, right? And then it just makes your day so much more wonderful to be able to kind of get it all done with.
So I'll tell you, you mentioned Peloton. So for the longest time, I was like, I'm never going to get a Peloton. I'm not going to be one of those people. And then I finally caved and I got it. And the beauty of it is so the username I have is self-principled, so people know it. They kind of follow me and I follow them. So I have all these people I follow. So it's almost like I feel guilty if I don't do it in the morning. So when I get up, it works.
Yeah, absolutely. Yeah, the group mentality. When I was training for triathlons, I would absolutely train with someone, because there was no way at 6 o'clock in the morning I was getting into a pool to swim a mile if I didn't have someone waiting there for me, saying, you better be here because I'm swimming. You know, I got out of my bed in the cold, and you better come too. So yes, it's always nice to partner things with a buddy, having a workout buddy, having a buddy that keeps you on track with your food plan. It's really nice to go through things with people. And I think that brings us to like a point where community and connections are so important, right? And that's part of where COVID was just terrible for us, because it made us all so isolated, which was terrible for mental health, as we know, and many, many other medical problems. But the connection that we feel with people is so important. And I feel like if we can get our spouses or our children to do small things with us, or anybody else in our house, our neighbors, whoever it just allows us to do things, and it becomes social. And then that's fun.
So, one of the things that you talked a little bit about was you meditating in the morning. Now, most people I talk to, some of the places where they struggle is they think of meditation and they get worried, or they say, I tried it one time and my thoughts just kept going through my head and it was too difficult. So for the folks who've never tried meditation, tell me some thoughts or some tips on how somebody could start. They've never done it. Or if you're already doing it, how you could improve it.
Yeah, I think these are great questions. And my journey with meditation was about 10 years ago in my own office, where we had a room full of patients, and there was a general surgeon. Her name is Gina Sager, and she's a wonderful, wonderful teacher. She was a general surgeon who retired. And this is unbelievable. And you'll understand this as a physician, that, surgeon mentality oftentimes is, if it's broke, you take it out, right? So if it's broken, you take it out. That's it, right? She entered our waiting room, and she told 50 people in there, basically, she's like, none of you need to be here. You can all heal yourself. And I was like, are you a general surgeon? What did you just say? But she talked about the concept of self-healing and the concept of mind body, and it blew me away. That was my first introduction to meditation. And I listened to her voice. So part of it is just open-mindedness to understand that this isn't going to be perfect. This journey, my meditation journey, has been over 10 years, and I struggle sometimes still with the thoughts. But the point is that it's quiet time. It's stillness. It's kind of like, the concept of fasting, which I hope we get to talk about. It's about time where things are just not, there's no news, there's nothing, there's no checklist. There's just this time where you're sitting in peace. And if you want to think about something like, random thought, I got to get a new leash for my dog. Okay, let that thought just come up and just kind of hang over your head. And then it just kind of, you acknowledge that it goes away. But it's very hard to do that in the beginning. What I find in the beginning that helps is maybe like a guided meditation, having someone talk you through the meditation, which is what happened to me. I heard her voice, and all she did was take me on a guided body scan from my head down to my toes. And she just had me breathe into each area where she's like, breathe in and think about, your eyes, and then move it down to your nose. And she just kind of went slowly through, but her voice is so soothing. And by the time I got to my toes, which felt like, I don't know, an hour later, which was literally only 5 minutes, I was in such a different place. My adrenaline had just come down. I was so calm and peaceful. It blew me away. I didn't even know that was possible. And so within 5 minutes that happened. And that was just from me following someone talk to me about a guided body scan. So I like the concept of guided imagery. I like the concept of watching your breath. I like apps like Headspace, which make it 10 minutes. It's a very wonderful, it's a well done app that is done by a monk who is also great with IT. And he has done a great job in giving us teaching tools in the app on what meditation is for the people who say, what is this doing in my brain? Why is this working? I don't understand. He does a really nice job explaining the theory and the science behind it. But starting with like a 10 minutes, 5 minutes, I think is great, because it seems overwhelming to do 20 minutes twice a day or 30 minutes once at a time. I don't know where I would find that time. So I think just simply a 5-minute guided body scan, just try it and see. And there's plenty of apps out there, Insight Timer, Calm, Headspace, that people can do. And so the other time to do it is when you can't sleep. If you're laying in bed and you don't know what to do and you can't fall asleep, try a meditation for sleep, something like Yoga Nidra, or any meditation for just laying on your back. That really gets your body more calm and relaxed. But initially, I think you need something like guided imagery. I've also done many courses like Transcendental Meditation, Art of Living, mindfulness courses. So there's many different options for meditation that even if you, and I rotate through all of them, I don't always do the same thing every day. But the point is that if you don't find something that's enjoyable, don't write off meditation as a whole, because there's the concept of breathing, which is pranayam, or just mindfulness, or the guided imagery, or the transcendental, which is just thinking about a chant or a sound. And all of them speak to different people. So there's endless opportunities to find a meditation, I think, that works for us. So I don't like.
In other words, find what works for you and just do it.
Just do it. Just do it. Start with 10 minutes, 5 minutes if you want. Start with it in the morning, start with it at night. A lot of people tell me that that's when they start, is nighttime, not the morning, because they don't have time in the morning. So they try to do it to help them fall asleep. It doesn't matter. I mean, even if you meditate during the day, it'll help you fall asleep better at night because your mind is calmer.
Yeah.
There's no wrong time to meditate.
Absolutely. All right. So tell me a little bit about your book. I'm really curious to see what inspired you to write it and what can people hope to get out of it?
I think our hope was to empower people. So I am an internist and my colleague is a cardiologist. And what we wanted to do was we wanted to empower people to take charge of their life and empower them in terms of the role they have. It is so powerful, these lifestyle tools that are in our decisions we make every day, all day. There's so many options for us to create a better path for us, and not in our minds think, I have diabetes in my family. I have this in my family, so I'm destined. I have arthritis in my family, I'm destined. Or the only option isn't going to your doctor and getting a pill. We wanted to open up the whole option of just, taking charge, but also we were getting kind of frustrated at, especially my colleague, Monica, who was seeing people after they've had their heart attack and seeing people after they've had a stroke, or, we wanted to catch people way before, because there's so much more potential. Not that you can't fix things once you've had an event, but there's so much potential to change your path and your destiny and your health and live well, right? We don't just want to live. We want to live well. We want to preserve our mind and our vision and our structure of our body. And we want to be able to live independently and maintain our social structure, social environment. So our kind of passion for the book was, we went on that journey singularly. I individually found meditation. She found it her way. We found the role of diet and plant-based diet and how impactful it was. And we kind of wanted to scream it out from the rooftops. We were just like, oh my God, people, we need to tell you about this because it's so amazing. Just try it. Because when I first saw my first patient, the way that I found out about the role of food, we had a nutritionist that was working with us, and she was working with some of my patients for where I was trying to take care of them for months, doing, medications and some small lifestyle things. And I remember one gentleman, he came back after 3 months and he had lost 30 pounds. And he said, oh, I saw the nutritionist. And the first thing I asked him was, what did she give you? Like, what did you take to lose weight? And he said, she didn't give me anything. She took away these foods I was eating. And I was, what? What do you mean? And it wasn't your normal foods. It wasn't like, my pretzels or it was that he went more plant-based and anti-inflammatory foods. And it blew my mind. I did not understand the concept of taking away something and causing such a dramatic change. So I was very inspired. And as our journey went on, we just found, as Monica and I were talking about the book, we both kept kind of fueling each other's passion, because we were both looking at the literature saying, oh my gosh, neuroplasticity, you can change your brain by exercise. Did you know that? Did you know this could happen? Did you know that could happen? And we were just so, I guess, excited about the possibilities. And it's all in the research. That's what blew me away. Everything's there. We just didn't learn about it in med school, and that was the problem. And so now you have to learn about it on your own, but it's so exciting because now my practice is mostly based on this. And it is very exciting to see what people can do in 2-3 months in their life by employing one or more of these changes. And the positive thing about this book, the changes that we talk about is, how does the microbiome play into everything? So a lot of it comes back to gut health, but we talk about exercise and food and the role of sleep and meditation. And our 2 new chapters in this book are the optimism chapter, the role of what our thoughts are that play into our health, and the role of fasting, and how we need to give our body periods of rest in order to heal, but also to kind of make us more resilient to illness and allow for change to happen, like changing insulin resistance and lipid profiles by merely changing the timing of our foods, which is incredible. So a lot of these things are just mind blowing, when you think about, wow, we have so much in our control. And that's kind of what was the predisposition for us to kind of write the book, was we wanted to just show it to all our patients and say, we don't only have 10 minutes because we were both on traditional insurance, but here's our book and read about it because it really makes sense, but come back and see me in 3 months.
That's awesome. You touched on plant-based diets, and what the evidence shows in randomized control studies is if you tell people, follow a whole foods plant-based diet, eat whatever you want, on randomized control studies, it shows on average they eat 500 calories less. Just based on the fact that this is not them trying to cut down their calories, not trying to lose weight, none of that stuff. Just for the fact that this is such nutrient-dense, calorie-poor food that you can eat so much. I can tell you, if you look at fast food meal, a burger and fries, and you look at the equivalent in plant-based, you're talking massive amounts of food you would have to eat, and nobody can eat that. So naturally, people end up cutting calories, which is fantastic. They don't have to feel like they're trying to deprive themselves. They can have all of those foods they want, still be able to lose weight. And that's a fascinating phenomenon. The other thing that's really interesting that you mentioned was optimism. We talk about this concept of a randomized placebo-controlled trial, and we say having that is the gold standard because placebo is so important. Placebo in literature can add up to 30% of the effect. But so people say, okay, well, we need to know that because it could, but if you stop to think about that for a second, just the fact that I told you that you're going to take a sugar pill, you might actually have your cancer improve.
Yeah.
Have your blood pressure.
Yeah, it doesn't matter. And most of the optimism literature is done through surveys and scoring and those kind of things. But it's impossible to negate that 30% that I feel like, why not get it? Why not have a better, even if it is something that's not, it's kind of like that parachute theory is nobody's ever checked in a double-blind placebo-controlled study whether you can jump out of a plane without a parachute, it would be okay. I mean, there's some things I don't think need it to understand that. Why not? Just try it. It's not going to hurt you, right? So I feel that way about optimism, but what blew me away with optimism was that I always thought it was predetermined. I thought it was, you were born with it and you just had the genes. Either you were optimistic or you weren't optimistic, but it's mutable and it's 40% is you can change it. And so that is, to me, was mind blowing because I always felt that I didn't have that optimism gene. And I have cultivated a much more optimistic attitude. ever since I started practicing things like visualization and gratitude journaling and meditating on a regular basis, I feel like my optimism factor has jumped 50% or 60% since I started my journey maybe 2, 3 years ago. But it makes each day so much better, even with every same circumstance happening around you. And I don't know how that could not affect my health, right? So if you're having, the positive attitude, especially in cancer patients, they say there's this unknown. Why do some people do so well? We don't know for sure. We're
Yeah.
not going to have a double-blind placebo study for that, but why not have a positive outlook for it, right? So I know the hard part is getting there, and that's why the practice is so important. The hard part is just there's not a light switch. Oh yes, I want to be an optimist. Let me check it off. The path is that we have to work at it, just like everything else. And the path is through things like journaling and things like gratitude and meditation and exercise and causing that, the elevation of dopamine in our brain and doing the things that are lifestyle friendly that will allow our brain to give it the best tools possible to have the best outlook possible.
I love that.
It's the work that has to be done.
And you said something that was so critical, and I want to highlight that again, was this concept of cultivate. So even if you're starting at a place where you're not working out, you're not eating healthy, you don't have optimism, you don't meditate, it doesn't matter. And I love that message of yours.
Right, because I think all of the things we have in our book, and this is what everybody says, well, where should I start? And I would say start to whatever speaks to you. If you feel like sleep is where you need to go, then start there. If you feel like you can just start with a gratitude journal, then start there. If you feel like maybe let me try fasting for 12 hours and not eating from my last meal to my first meal, start there, because it's all positive. It's a positive cycle that goes upward. Most people start with diet, which is great, but there are people that are already eating really well that are feeling like, well, why don't I have energy? Why I'm eating so amazing. I cook everything and I listen to their food and they are doing the best they can, but they're not sleeping, or they're taking care of someone who's in their house that has dementia, or, there's so much stress in their family or whatever it is. So we have to work on what speaks to us and what we can do to make a little bit of a difference, right? So it's a personal journey, and that's what the book is also meant to be. It's a guidebook, but it's a journey for each person to do with what they want. But we try to highlight the evidence and the research behind each thing that we're recommending. But I feel like these are the best prescriptions I can ever give a patient, as opposed to any drug I can give or any surgery I can send them for. It's really so life altering. And so that's what the book was based on, is trying to give prescriptions to our patients that are in their control.
That's fantastic. And now you mentioned a topic that's near and dear to my heart, which is fasting. And, I practice fasting myself. I find that if you couple a whole foods plant-based diet with fasting, you can get some fantastic results. But tell me a little bit about fasting. What's your philosophy? How do you start?
So I've always been a type of person in the beginning where I could not ever do fasting blood work. The thought of it just scared me, because I would be such a monster by 7:30, 8 o'clock. If I didn't have something to eat, I would just get hypoglycemic and irritable. And I never thought I could do that. Now I can go 3 days without eating because I've worked at it. So I think I started with 12 hours. And I started pushing it to 13 hours, where my last meal would be dinner around 6 or 7, and my first meal would be 7 in the morning. And then I pushed it to 8. And I think one time I just forgot to eat, and then the next thing I knew, it was 10 o'clock. I was, oh my gosh, I did 13 hours of fasting. I can't believe it. And it just became easier and easier. And so now as a routine, I'll do 16 hours and I'll eat in an 8-hour window. But I took a long time to get there, maybe 8 months. But the other thing that I do is fasting mimicking, which is the Prolon from El Nutra company. That also was a game changer for my practice and my patients and myself. It allowed me to, it's for people who don't know, it's kind of like a preset fasting. It's supposed to mimicking a water fast for 5 days. And the concept of a water fast is very hard for most people to do. And I don't recommend it except for a handful of people. But the fasting mimicking diet allows you to take in calories, but it's managed in the macro micronutrients in such a fashion that it kind of mimics your body to think that it's having a water fast, and the changes that they've seen in the blood work with whether it's CRP or markers of inflammation or glucose control or lipid panels or even waist circumference are similar to the changes as if those people drank water for 5 days. And so because you're eating something, it fits our social issues on, times of meals. And if you're hungry, you can still feel like you're not starving. So it's been great. I've added that to my practice several years ago, and it's been incredible in terms of teaching people the concept of fasting because, and then from that, they segue into time restricted feeding, which is the 16-8 window or the 12-hour fast or the 12-14-hour fast. So it's become more of a habit once they've done the fasting mimicking plan. And so I use those two very routinely in my practice to try to get people to change, because we know even in the longevity literature that it's, the reduction of calories has helped just having people live longer, at least in animal models. And now they're looking at that in people. But in general, for those who eat plant-based, right, they're taking in less calories as a rule. They're more active in the blue zone data that we have. So we know that all of these things can add up. And that the end game is for us to age gracefully and to be able to be independent and preserve our body functions and our structure. And so I think fasting is critical to that. I think we need to do that in order to maintain graceful aging. So I do talk about it often.
No, I absolutely agree. And, for our viewers out there, just two cautions that I always give is if you're pregnant, if you're type 1 diabetics and you have issues with sugar, those are the ones that are the contraindications. But, fasting has been done by every culture, every religion for thousands of years. So even though science is just catching up to what we've already known, there's a lot of historical evidence behind it. It's similar to a lot of foods that we eat, like turmeric. In your culture, my culture, which is very similar. I mean, we cook with turmeric. We use it as the root itself. We do so much with it that we never thought about the health benefits. That's just, it is. But science is now starting to tell us all of these benefits that are associated with it. So it's fascinating.
So we actually have a chapter in our book on spices because we find it so important. And of course, turmeric is in there, ginger, and we talk about, our top 10 where it's rosemary and garlic. And it's just, there's so many out there. It's impossible to kind of talk about in one chapter in our book, but the concept is just use it, right? Because you can put it in foods, but you can also put it in water. You can put it in beverages, which is amazing place because yogi tea, I don't know if anyone's ever heard of yogi tea, but yogi tea is just basically with or without black tea, it's a bunch of spices and water. And it's amazing. And the strongest antioxidant we know, I think, in the literature is cloves. And how often are we cooking with cloves? I'm not sure. I'm not doing it that often, but I put it in my water and I drink it, and it's magnificent. And the black tea, for those people who don't want to do caffeine, regular yogi tea with turmeric and ginger and cardamom and these other spices is so refreshing. And ginger is such a great gut healer. It helps, a lot of what internal medicine, we do a lot with the gut. And I'm using ginger all the time. I'm recommending it all the time to people just because it's at home. When you get the calls from people, I have this going on. What do I have? Go into your medicine cabinet, go into your refrigerator, pull out the ginger. I'm using turmeric and ginger and cloves for dental pain. I mean, we're using a lot of stuff that is in their cabinet as medicine. And that's what they used to do, right? Wars were fought over spices in the past. They're magnificent.
They are magnificent. And, there was a really fascinating study came out just about a year ago. What they showed was if you have salt addiction, one of the best ways is to use spices because spices act on the same portion of the brain as salt does. So it's a great way to overcome those addictive habits to salty foods. You just start using some spices in there.
So the American Heart Association actually has a page of spices on their website. And one of the reasons when you said, why did you get into this avenue? I'll tell you, was a patient of mine who was in his 30s. He came in with his wife and he said to me, well, if I can't, he was a hypertensive patient. And he said, well, if I can't use salt, what am I going to put in my food? I had zero answers for him. I didn't know. I didn't actually know the answer to it. So I went and I researched it and I found it. And then that was what prompted me to have a cooking class with my female colleagues because I said, we all need to know what to tell our patients when they ask this question. This poor wife was looking at me, how am I going to get him to eat any food if I can't put any salt in it? And I don't know. I don't really know the answer to that. So yeah, I mean, we tell people these things, right? We say, don't do this and don't do that and don't do this, but we're not telling them what to do. And so that's what the book's about. The book is what you should do instead of what not to do. So, and that kind of is where we fell into it, because we were running out of our patients were asking great questions. We didn't have the answers.
Yeah. Well, it sounds like a fantastic book. Do you have a website where people can find out more if they want to learn?
Yeah, so Body on Fire, if you see this, it's available on Amazon. It's also on my personal website, which is Shakti Health and Wellness Center, or rawwellness.com, and Dr. Monica Agarwal, her personal site as well. And so, yeah, I think the only place to get the book, though, is on Amazon.
And Shakti Wellness, spell Shakti for me for folks watching.
Akthi, Shakti.
Perfect. All right, so I ask this of every single guest, and as we close out the show, is to give us their top 3 or 4 things that people can take away, start doing right now, that can put them on the right road to health and wellness. So putting you on the spot a little bit, what say your top 3 or 4 things? Doesn't have to be 3 or 4, but what would you say?
So one thing I would say is to fast. I think everybody can eat less. I mean, as long as it's safe with your physician, as long as you're not on insulin or some medication that's going to prevent you from being able to fast. I do think most of us are eating too often and too much. And so by reduction of the calories that way, you can also start to give your body a rest. So the theme for me is more rest and less noise. So the second thing I would have people do is to meditate, or to find a quiet time, quiet space, turn off electronics more, not look at your phone as much, pick a time once an hour to check your emails, not every 5 seconds. It's more of a habit that we do, and trying to create more of that mindfulness type of environment where we're present and we're aware of what we're doing. So just create more quiet space and downtime. And the third thing I would have people do is gratitude journal. I think the world right now is full a lot of negativity, and it's very easy to get sucked into that negativity. And if we keep looking at what's not there and what's wrong, that's what's going to happen inside of us too. So if we can start looking at the right side, journal 3 things a day, start hanging out with people that talk about positive things, not just the negative things. It's about kind of shifting that focus to looking at the positive. So fasting, maybe quiet time, meditating, and then journaling. Those would be the 3 things I'd have people start.
One of the things that I'm so grateful for is when I do these interviews, I feel like every single person I have on the show, I learn from them and I grow, and I get to sort of feel that spark of hope. It's kind of like when you were first starting med school, you were like so excited, and it was just all new information. And that's what I get out of each of these interviews.
Yeah. I know there's so much to learn. It's such an exciting time, because especially with all the microbiome literature that's coming up in the research, it's really exciting to read the journals and talk about these things with our patients. And just this week, I've had 4 patients that I've talked to, and everything we've talked about was about related to spirituality and optimism. That was my consult. It was amazing. We weren't talking about what was broken or what was wrong or what was not feeling good. We talked about the hopefulness of everything and the spirituality of things and the optimism and how to cultivate these things. And that's where I think our role as physicians should be as well, not just thinking about what's wrong, but how do we get to what's right and what are the practices that I do? Because honestly, I'm learning from my patients every day, and their questions drives what my answers should be. And that's why I keep searching, is that we want to be healers. We want to ease suffering. So part of it is I like people to ask questions and really think about things, because it makes us look more and research more and find those answers. And in the process, we grow, right? So it's awesome.
Well, this has been delightful. Dr. Rao, you are a wealth of information. What a great way to end this show on hope. And for everybody watching, there's lots of hope in this world. You can always start wherever you are, however you are, whenever you are. It's never too late in your life. These concepts that we've talked about today, meditation, fasting. I love this idea of more rest, less noise, right? And the gratitude journal is so powerful. So thank you. It's been a pleasure.
Thank you. Thank you for having me.